Hi, this is Delaney Brooks, and this is my presentation on access to and disparities in healthcare for Native American populations. So I've decided to divide this into two large parts, the why section, which will include why American Indians and Alaskan Natives should be a topic in the first place for someone in Central Illinois to care about. And I'll bring to light some of the things that they face and some general statistics about their experiences. The second section, the how section, will cover how to communicate with these disparities in mind and different ways that you can make a difference. Today, there is an estimated 4.5 million American Indians and Alaskan Natives, with anywhere from 22 to 30% of those living in reservations. There are a total of 326 reservations located in 36 of the 50 United States. This, along with 28 reservation hospitals to serve almost 2 million people, means that each hospital accommodates around 72,000 people. This doesn't include hospitals that are not on reservation land that American Indians have access to. A little more math, there are approximately 56.2 million acres of reservation land in the United States, meaning there is one Native American per 26 acres, around about. So what does all of this mean in regards to healthcare disparities? This means it might be more difficult for Native people to get to a healthcare facility or for an ambulance to get to them. And when Native people do arrive to these healthcare facilities, whether it be a clinic or a hospital, you name it, there might not be enough room for them. So the national poverty rate for Native Americans was at 25.4%, while Black Americans were at 20.8% and Hispanics 17.6%. This meaning that Native American people are among the most impoverished minorities. Poverty rate being the number of people whose income doesn't meet their needs, including things like food and utilities. Also, American Indians and Alaskan Natives are more likely than any other minority group to have no form of health insurance. The average life expectancy is 78.4 years, combined men and women, which is 2 years less than non-Hispanic white Americans on average. And Native Americans are also more likely to experience health complications due to cirrhosis of the liver, teenage pregnancy, and diabetes. So again, what does this mean? This means that Native people are predisposed to healthcare issues due to their culture alone. Many Native Americans also choose to use traditional methods for healing. Alternative medicine and treatment is a large part of Native culture. In Hawaii, the pre-Captain Cook diet aims to reduce empty calories, fat, and additives to promote a healthier, more balanced diet by restoring the role of indigenous foods. The Cherokee use dandelion heads in infusions for their pain relieving properties. Many tribes also will seek out the advice of a healer or medicine man for their ailments. Today, these treatments are often used side by side with modern treatments to promote well-being, but it always wasn't like this. For many years, as medicine was evolving, Native Americans populations faced discrimination from those that were at the forefront of this medicine at the time. This led to large amounts of distrust in westernized healthcare, and this distrust still exists today due to continued discrimination as well as just fear of being misunderstood. So this is just my advice on how to give more culturally competent care to Native people. So reconsider how you communicate. Native people are very diverse, so this of course won't apply to everyone, but here are just a few things that they have in common. To start, the census lists them as American Indians and Alaskan Natives, but you may also hear, Native Americans or just Indians. And there are some that take offense to certain terms, so it is really important to just make sure that you ask what term they prefer. Something else that may make your communication more effective is considering the importance of respect. Respect to both the patient and the patient's family members is a value that Native people hold high in their communication. Native Americans will also tend to value respect to those with more wisdom, usually the elderly. Also, many Native cultures use humor and are often telling jokes and stories. I mentioned this largely just as an FYI, so don't be afraid to laugh when maybe you tell a joke or a story of your own. As I touched on earlier, many of the top causes of deaths among Native American populations were preventable illness. So providing education on that preventable illness, liver disease, diabetes sit at the top, with stroke and heart disease not falling far behind. There are also high rates of teenage pregnancy and abuse of drugs and alcohol. Consider education on these things if you get the opportunity to talk on them. A quick discussion about condom use to prevent teenage pregnancy and abuse of mentioning AA to an alcoholic, and providing information on diabetes is the first step in lowering some of these numbers. Finally, being understanding of any possible hesitancy, whether they are used to healing methods seen at home or are used to a healer, or may just be uncomfortable in general. It is important to make people comfortable regardless of their background, make sure they feel welcome and safe. You never know what someone else may be going through, so it's important to be empathetic and respectful to form a trustworthy relationship. So this is just a diagram that I made, screenshot it, keep it in your notes. But just everything I kind of have summarized here, just to make it a little bit easier to see, just to see everything I've covered. And here are my references. Thank you.